Hi guys, so I'm here sitting with Dr. Ronson Reeves. He's my dentist and my friend for like ever. Introduce yourself.
Hi guys, Dr. Ronson Reeves here, general dentist.
That's it?
Okay. Dental surgeon.
Yes, okay. Alright, so I wanted to start off by asking you some general dental facts.
Right.
So stuff like, how often should you brush? How often should you change your toothbrush?
Right. Okay. Well, universally we say brush twice a day. Right. Now, certain people might need to do more than twice a day. For instance, after every meal. Example: if you have braces and the food gets stuck in the braces twice a day, it might not be enough. You might need to do it after every meal. Or if you have certain gum conditions where food gets trapped in the gums and in between, twice a day might not be enough. So twice a day is general, but usually if you need to do it more than twice a day, your dentist will let you know. Flossing is also important. We like to say only floss the teeth that you want to keep. So brushing and flossing is important. If you don't floss, you're actually missing about 33% of the tooth, which is in between the teeth where the toothbrush can't reach.
Is that where
that's usually where most of those cavities that just pop up on your form, in between the teeth. So yes, flossing is important. We recommend you change your toothbrush every 3 months.
Really?
Yeah, every 3 months, as in 3 months should be the longest time you have a toothbrush for.
So it's not when the bristle them skin out?
Even every 3 months, regardless of whether the bristles spread or not. Because after that time, the toothbrush usually loses its effectiveness. But if you are doing your brushing regularly, twice a day or after every meals, it's gonna fray before 3 months. So.
Okay.
And we also recommend definitely a soft bristle toothbrush.
But Jamaicans love the firm.
They love the firm bristles, and I'm not sure why. When I use firm bristle toothbrushes, they cut my gums and I bleed a lot. So I would like to challenge everybody: if you're using a hard bristle toothbrush right now, switch to a medium or a soft toothbrush for 1 month. The first couple of days are gonna feel like it's flimsy, like it's not cleaning properly. Just stick to it for 1 month. And I guarantee you, if you go back to your original toothbrush, you're gonna see bleeding and it's gonna feel like you're using steel wool. So usually hard bristles are for people who have dentures or prostheses. Regular teeth, you don't need more than a soft toothbrush to brush.
Okay, what about those electronic toothbrush?
The electronic toothbrushes are very helpful for people with disabilities or dexterity issues. So people who can't reach all the areas with the regular toothbrush, then I would recommend a manual electric toothbrush for them. However, some people think that because the electric toothbrush actually has a motor and it's spinning, that all they have to do is put it on the teeth and it does the work for them. That's not so. Usually you can get a better, more defined clean than when you have your regular toothbrush and you can target certain areas. So the electric toothbrush, I think, was generally designed for people who have dexterity issues or handicaps who can't actually use them and manipulate the manual toothbrush correctly. So it's not to say that it's better than, it's just better for some people.
Okay. And what would you say when you said dental care? So it's to brush and floss?
Dental care, I think, is brushing, flossing, and also visiting your dentist at least twice a year. Twice a year. If you have medical insurance, your insurance pays for a checkup and a cleaning every 6 months. So it's standard that after every 6 months you are supposed to get a cleaning. Some people actually need to do a cleaning every 3 months. Some people don't need to do a cleaning more than once a year. So everybody is different. It depends on how the teeth are, how well you are at your own plaque control. But brushing and flossing twice a day is not enough. You need to also back it up with having a dentist see you. We recommend twice a year.
What are some indications that it's now is a time for cleaning?
The most common one is bleeding gums. When the plaque builds up on your teeth, it causes a reaction of the gums and they tend to bleed. Sometimes if you just touch them, if you bite into an apple with brushing. So usually bleeding gums is a general sign that you need to see a dentist for a cleaning. Also, after you get the cleaning, the bleeding gums might go away, and after a few months, you might notice it's starting to come back again. That's a sign that the plaque is building up. So that's usually the general sign. Other signs can include, bad breath issues. Although I don't want you to think that teeth are the only reasons why you get bad breath. But I mean, if you don't have a cleaning done, that's a good indication as well. And I guess general pain, discomfort, swelling in the gums.
What about fuzzy teeth? Like even if you brush your teeth, like maybe an hour later your teeth feel fuzzy.
That fuzzy feeling is plaque. Plaque starts to build up as soon as you finish brushing. It's constantly building. So you constantly have to be fighting it with brushing. So fuzzy teeth is definitely a sign that you need to get a cleaning done.
Okay. And dental care is important. Why?
Well, first of all, like with most medical conditions, early detection is key. So usually people don't go to the dentist unless they're in pain. And by the time you're in pain, it's too late. The tooth has 3 different levels, and you can have a cavity in the outer or even middle layer and not realize, not feel it, not having any discomfort. It's when it reaches the nerve and you need something much more expensive than a simple filling that you start to get the pain. And usually it's too late. You're going to have to do a very expensive procedure. You might even lose a tooth. So we recommend seeing your dentist regularly, so that even if something pops up, if you see them within 6 months, it's still kind of early enough to catch it and fix it before it gets too out of hand. Also, certain people have different medical conditions which make them more susceptible to certain diseases. Pregnant women have a difference in hormonal changes, and that can spark a reaction in the gums. Diabetics, they have a harder time fighting infection. So a simple plaque buildup, which might not have an effect on a normal person, might cause serious gum disease in a diabetic. That sort of thing. So there are many different factors which indicate why dental visits are important and should be done frequently.
So you spoke about diabetics and so forth.
Right.
Is there a way, when I visit you, are you able to tell if something else is wrong with me based on my dental care?
Sometimes we can, yes. A lot of issues. So for instance, anemic patients, the gums might look pale. Diabetic patients might have puffy gums. They might have little abscesses, which probably you wouldn't normally see in a regular case. Patients who are bulimic, for instance, and they regurgitate a lot, you can see the wear of the acid on the teeth. Dry mouth also. Dry mouth can cause or promote cavities because saliva actually helps to protect the teeth by washing them. So there's quite a bit. Oral cancer, with the oral cancer screenings as well, little blemishes or marks which you don't normally see in the tongue, cheeks, and so on. When we're doing an exam, we also do an extra oral, so we'll palpate or feel the lymph nodes to see if there's any lymphadenopathy. That would be a sign of an infection somewhere. So it's not just for cavities or loose teeth, or there's a lot of things that can actually show up or make us say, there's something going on here. You might want to check your doctor to see if there's an underlying factor.
Okay, awesome. So it's kind of like a little checkup.
It's kind of like a mini checkup, yes. So for instance, if you go to the dentist, we might frequently just check your high blood pressure, just check your pressure just to see if you're hypertensive. A lot of patients in my practice, when I'm doing an extraction, for instance, I just been happy just take the pressure. And there are instances where people have been diagnosed with high blood pressure just by coming to the dentist to do a regular cleaning, just because the dentist decides to take your pressure, and they have no idea otherwise. The hypertension is a silent killer,
right? And
so on. So definitely.
All right, and so what are some of the strangest things that have ever happened as a dentist? Like, give me one bizarre instance.
Well, I did have one patient who was not aware that she was at the dentist. So she came in, she had a seat, we asked her what her problem was, and she proceeded to describe some vaginal discharge that she was having. And I had to quickly stop her and let her know that this is actually a dental office.
So she didn't read the sign
She
on the door?
didn't know, I'm not sure if she was aware that it's a dental office. That's one of the strangest occurrences that has happened in the dentist. That actually stands out for me.
Okay, and what's the worst case you've ever, where someone has waited till it was really bad?
Right, okay, so I had a patient who came in frantic, saying that they had a piece of the teeth that had broken off when they were just eating a regular meal. And they weren't feeling any pain, but they were very concerned that they broke a tooth.
Right.
When we did an examination, the teeth were fine. They didn't actually break a tooth. What had happened was the plaque had built up such a huge wall on their teeth that it was a piece of the plaque that had broken off. And it was such a sizable chunk, they thought it was a piece of tooth.
Goodbye.
Yeah. You see some gruesome stuff. Usually if you're in pain or
discomfort,
it's usually too late. It's usually like a sign that it's gone too far. So check your dentist before any problems, so that if there is anything that pops up, they can quickly address it.
All right, so I know I came to you already where I was feeling pain. As someone that has no cavities, I came to you because I was feeling pain in my teeth, and you explained to me that it was I was stressed. So you're able to.
Right. So the teeth are held in place by what we call periodontal ligaments, which sometimes mimic the actions of a small muscle. So if you are stressed, you tend to grind and clench your jaws. And just like if you're in the gym, if you work a muscle too much, it will feel a little discomfort. So there are times when patients have this pain in the muscles of the jaw. They can't find out what the problem is. And on closer examination, it could be a case where they have grinding, or what we call bruxism, or just stress grinding. Also, some patients with sinus issues can have pain in the top teeth, which they might go to the dentist tells them they don't have any cavities, but they have this pain in the top teeth. It can also be linked to a blockage in the sinus.
Okay.
So there's a whole lot of factors you have to take into consideration when you're trying to assess dental issues.
And I wanted to discuss bad breath.
Right.
So you touched on the point earlier that brushing your teeth isn't always, or not brushing your teeth isn't always the cause of bad breath.
Right.
Could you tell me some other
Sure.
causes?
Actually, in my opinion or in my experience, patients who come to me for bad breath, only about 20% of them are tooth related, as in it's because of a source of infection or some bad tooth. Most of the times it's either from a draining sinus, or if the person has acid reflux, or they're always bringing up or belching up food. Those are the two main things that cause bad breath. Usually you would have to be very neglectful of your oral hygiene for it to be the main source. But like I said, it also contributes, but I find most times, especially with patients who have good oral hygiene, they brush their teeth twice a day, they use mouthwashes, they floss, they chew gum to stimulate saliva, because dry mouth contributes to bad breath, and they still have it and they can't understand. They have a very bad uncontrolled sinus problem, or they have bad stomach reflux. Those two things really also contribute to bad breath.
Okay. Last question. Is there something really called hungry breath?
Yes, there is. Basically, like I said, saliva protects the mouth and also washes off the teeth, and it kind of helps to keep odors down. So if you have a dry mouth usually equals a stink mouth. So that's why sometimes when you wake up in the mornings, you haven't had anything to drink for a few hours, you're sleeping or in a state of rest, that morning breath is usually not fresh, and that's mainly because you haven't had anything to eat for a long time. It's dry.
But why some people morning breath wickeder than others?
They didn't brush their teeth before they go to bed, or they have some kind of sinus issue, like I say, or they have some dental problems. So it's a whole bunch of factors. But yes, there is such a thing as hunger breath, definitely. And it's usually because the oral cavity is dry, they haven't eaten anything in a while, saliva is dried out, and so you have this hot, dry breath that usually is not pleasant.
Thank you so much, Dr. Reeves.
All right, no
All right,
problem.
cool.